Hey everyone, and welcome to Medical Careers You Didn't Know About. I'm Infinite, and today we're diving into healthcare's most overlooked but absolutely essential roles, the Medical Authorization Specialist. This series is all about uncovering powerful career paths that don't always get the spotlight, roles that are strong, stable, growing, and don't require a medical degree to get started. If you're ready to explore a career path that bridges patient care and insurance approval, stick around. Be sure to like, subscribe, and share this video with someone who's ready to pivot into a more meaningful profession. And if you're serious about making a change today, you can grab the comprehensive downloadable roadmap in the link in the description below. It's a step-by-step guide to navigating this career with confidence and clarity. So, with that being said, let's get started.
Step into the world of infinite intelligence, where knowledge meets entertainment and brilliance. You'll find the answers to life's greatest questions. With every video, we spark new obsessions. Infinite intelligence, we here to elevate. Unlock your mind and let the wisdom resonate. We dive into the depths of the universe unknown. Infinite intelligence, and knowledge is our own.
Welcome to your comprehensive guide to becoming a healthcare authorization specialist. This roadmap will navigate you through the essentials of this critical healthcare administration role. Whether you're just getting started, whether you're just starting your career or transitioning from another field. In the following slides, we'll explore everything from role responsibilities and daily workflow to salary expectations and advancement opportunities. Let's begin your journey towards a stable, rewarding career in healthcare administration. Now, what is an authorization specialist? A healthcare authorization specialist serves as crucial intermediaries between healthcare provider, patients, and insurance companies. They ensure medical procedures, treatment, and services receive proper approval for coverage before they're performed. These specialists work primarily with hospitals, clinics, physician practices, insurance companies, and increasingly in remote work environments. Now, what are some of the key responsibilities of authorization specialists? They are verifying patient insurance between, verifying patient insurance benefits and coverage details. They are submitting and tracking authorization requests. They're communicating with providers and insurance representatives, documenting approval information in medical record system, and resolving denied authorizations through the appeals process. All right. So you might be thinking, okay, this sounds like me. This sounds like something I could do. So before you make your decision, which is the whole purpose of this video, let's go over some of the advantages of this career. This career is an excellent for job stability and healthcare industry growth. There is remote work opportunities becoming increasingly available. This position does have regular business hours. Typically, you're 8 to 5, Monday through Friday. There is an entry point into healthcare without a clinical background. And working in this role or other roles in healthcare have transferable skills in multiple healthcare sectors. All right. So, what are some of the challenges in this career? This career can involve repetitive tasks and high volume workflows, frustrating insurance delays, and denial manage. Keeping up with constantly changing payer rules, and we spoke about that in a previous video. Managing patient and provider expectations. And lastly, requires attention to detail and deadline management. So you will definitely be doing a whole lot of multitasking. All right. What is your work environment going to consist of? Most specialists work in office settings or remotely using specialized software systems. The role involves significant phone and email communication along with detailed work documentation. Now, what requirements? So you're thinking, okay, this is for me. I'm ready to make my decision. Where do I get started? What do I need to get involved with this? All right. So you're going to need your minimal education of a high school diploma. Let's see here. We also have possibly associate's or bachelor's degree in the administration role, healthcare administration role, medical billing or related fields preferred. Some employers accept relevant experience in place of formal education. There are certifications that would definitely be beneficial, such as Certified Medical Reimbursement Specialist. That's a CMRS. We also have a Certified Professional Biller, CPB, or a Certified Professional Compliance Officer, CPO. No, CPCO. Now, these credentials can accelerate career growth and increase earning potential. Now, these are not all of the certifications, but these are just some of the certifications that you might be interested in when you involve yourself in this particular field. Okay. Now, what are some of the soft skills that you will need for this position? Strong communication abilities, problem solving skills, attention to detail, organizational capabilities, patient empathy are essential. Um, the ability to manage multiple priorities and handle rejected professional handle rejections professionally is crucial. Okay. I hate that I said patient empathy are essential. Why does it say are right there? It's like patient empathy is essential. So, no. But anyways, I'm just being anal right now. Moving forward, technical requirements: proficiency with electronic health records, the EHR system. We went over that in a previous video. The insurance verification platform, Microsoft Office, and medical terminology. Basic understanding of medical coding, which includes the CPT codes and the ICD-10, is highly valuable. And we will go into that a little further. Now, what is your, and this is, like I said, this is just a template of what your work flow would look like, okay? So we have a morning from 8 to 10. You'll be checking your email, voicemail for urgent requests, review the day's pending authorizations, submit new authorization requests for scheduled procedures, make follow-up calls on pending requests approaching deadlines. All right. Midday, we have from 10 to 12. Respond to provider inquiries for authorization status. Contact insurance companies for updates on pending requests. Document all communications in electronic health record system and begin processing appeals for denied authorizations. Then we have from 1 to 3, which is the afternoon, participate in team meetings and case reviews. Complete any remaining new authorization submissions, update authorizations tracking log, communicate approvals to scheduling department and providers. All right. And lastly, toward the end of the day, I have from 3 to 5. Prepare priority list for the next day. Finalize documentation for complete authorizations. Address any urgent same day requests and complete daily productivity reports and close out pending task. Okay, and this is just a ideal template of what it would be like. Uh, just giving you an idea. Okay. So, what is the career path typically? And once again, this is just giving you a visualization. At the bottom, we have entry level positions, which would be some of these titles are interchangeable, and the responsibilities are subject to be more or less authorization coordinator and authorization representative. Okay, the next level will be a experienced specialist, which is a senior specialist, a trainer, a complex case specialist. All right, moving up, we have a specialized path. We have a utilization review, revenue cycle management, and compliance. Moving up for the advanced specialist roles, we have team lead, supervisor, and department manager. And lastly, leadership positions, we're looking at authorization director and healthcare administration executive. All right, many specialists begin in entry level positions and advance through experience and additional credentials. Some transitions laterally in into related fields like medical coding, billing, and patient financial services or utilization review. With experience, you can specialize in complex cases, particularly medical specialties, or more into supervisory and management roles. All right. Now, here I have a chart, and like I said, these numbers are subject to fluctuate. You do know what type of times we are in, but for the entry level, I do have it around about 35,000. From 1 to 3 years, we have 42. 4 to 6, we have 48. From 7 to 10, we have 55. Senior and lead, we have 65, and management, we have 75,000. Okay, so healthcare authorization field is the healthcare authorization field is expected to grow 8 to 10% over the next decade, faster than any average job growth. This expansion is driven by an aging population requiring more medical services and the increasing complexity of insurance requirements. Salary is influenced by several factors, including geographic location, facility type, experience level, certifications, and specialized knowledge. Urban areas and large healthcare systems typically offer compensation than rural settings and smaller practices. All right. So, like I said, these numbers are not set in stone, but it does give you an idea of where you may or may not stand in entering in. Okay, and what you have to look forward to. Okay. All right, so what are some of the mistakes that you can avoid? So this is just some things that you might want to look into when going into this. All right, so missing deadlines. Now, failing to track authorization timeframes can result in delayed care and frustrated patients. And it might not you might not get your authorization all the way, an approved authorization. So you definitely want to stay on top of deadlines and time frames. Deadlines and time frames are very important in any role in medical, but definitely when you're dealing with these authorizations, because procedures and everything is attached. They might need to change something. They might need to update something, and the sooner we go ahead and get this approved and going, the quicker we can go ahead and see the patient get it done, or whatever else we need to do, whatever other processes are entailed. All right. So also, incomplete documentation. Submitting requests without required clinical information causes unnecessary denials. Okay, so along with the time frames, you got to make sure that all the documentation submitted in regards to the procedure is there. It's signed, it's initialed, whatever the required documents that are needed. Make sure that they are up to par and the standards, uh, because that can directly result in delays or a flat out denial. Okay. Overlooking alternatives, failing to explore alternative authorization pathways when standard processes fail. So just because you get a denial does not mean that you cannot appeal or not submit something to change uh, the outcome of what you just received. So if we're just sitting back and accepting denials, we're not going to get anything paid. You can't be passive in any position in medical. You can't. So you have to be assertive, and you need to be figuring out what alternatives are there out there to go ahead and get this authorization approved. Okay, and neglecting updates. Not keeping authorizations informed about authorization statuses create workflow interruptions. I can't speak tonight. Disruptions. Meaning, if providers are seeing patients, right, and the provider says, hey, you need to have such and such surgery, we're looking at such and such time, and we're going to go ahead and submit this in to go ahead and get approval for this authorization. And you're doing all these things. We're missing the deadlines. We have lack of documentation, and we're overlooking alternatives. That's disrupting the workflow as well as the money flow of the whole operation. Things need to be addressed in a timely manner so the cycle can continue, the patient can be seen, and resolutions can be met. Okay. Now, many new specialists underestimate the importance of understanding medical necessity criteria. Each insurance company has specific guidelines determining what they'll approve. Learning these criteria and ensuring documentation supports them is crucial to authorization success. Okay. Another common pitfall is neglecting to stay updated on changing payer policies. They do change frequently. Set aside time weekly to review updates from major insurers to avoid surprises that could impact your authorization. All right. So the last thing you want to do is be recommending surgery, and we don't have anything approved. It's not covered. We didn't do any research. Okay. Now, I'm giving you all this information. You're ready to go ahead and get started in your medical career journey. Now, you're probably wondering what are some resources and tools that you can use to go ahead and move forward about your process. Now, we do have professional associations such as the American Association of Health Administration Management, the AAHAM. We have the Healthcare Financial Management Association, the HF MA, and we also have American Health Information Management Association, the AHIMA. So you can, this is not a sponsored video, but you can start there. Now, for educational purposes, and like I said, those are just professional associations, organizations that you can join. But there are also educational resources and organizations that you can join, such as the AAPC, which is who I'm a part of, but they also have Practice Management Institute courses. AAPC has medical training authorization, medical authorization training, LinkedIn Learning Healthcare Administration courses, and Coursera Healthcare System Specializations. All right. And we also have technology tools such as Ability Authorization Management, Navinet Authorization Submission, Change Healthcare Authorization Manager, and Epic Prelude Authorization Module. All right. So those are educational resources that you can start to help you get started, okay? Where you can look at to help you get started. All right, so what is some medical? You will definitely need to familiarize yourself with medical terminology in general. But what is some immediate medical terminology that you need to be aware of, you need to know of before you get started? All right, so first is prior authorization, and the abbreviation for that is PA. All right, insurance require, and this is defined as insurance requirement for approval before a service is performed. So what does that mean? That means before I can perform this procedure, it needs to be approved by the insurance company, and that approval is approved with an authorization number. So I need a prior authorization, an approved authorization before this procedure can be performed. All right. Medical necessity. Criteria determining if a service is reasonable or necessary for patient care. And that means, hey, was this procedure necessary? They also have medical necessity when going into the emergency room, because some of that stuff does not meet emergency room requirements. So it's not going to get paid in full if the requirements are not there. And those requirements are defined in diagnosis codes. But we're not going to get into that. All right. So, CPT codes, current procedural terminology codes used to identify medical services. So, you definitely need to be familiarizing yourself with knowing what CPT codes are, which are procedure codes, as well as the ICD-10 codes, which are diagnosis codes, the International Classification of Disease codes identifying diagnosis. Uh, so yeah, and even diagnosis has, I don't have it on here, but the word diagnosis, you're gonna see the word, when you see DX, that means diagnosis. So you just want to prep your brain for that. EOB, explanation of benefits, document detailing insurance company coverage. So you will be looking at a lot of EOBs to verify what the coverage is, what the coverage has covered, all that. Utilization review is a process of evaluating the necessity, the appropriateness, and the efficiency of healthcare services. All right. And peer-to-peer direct discussion between physicians to resolve authorization disputes. All right. So anytime authorization is denied, a peer-to-peer, a lot of times a peer-to-peer is performed to see if it can be over, that decision can be overturned. Okay. Mastering these terms and concepts is essential for effective communication with insurance representatives, providers, and other healthcare professionals. Consider creating flashcards to help memorize important terminology during your first months in the role. Understanding the relationship between diagnosis codes, the ICD-10, and the procedure codes, the CPT, is particularly valuable, as insurers often require specific diagnosis codes to justify the medical necessity of requested procedures. Okay? Now, what is my final encouragement of this video? All right? So, where are we going to, after we've wrapped up this video, we're at the end. What are you about to do? Okay? We're going to begin with the fundamentals. Start by mastering the basics of insurance verification and medical terminology. So you definitely want to brush up on that. There are some websites out there that you can start taking medical terminology classes and get a certification in that. That will definitely help with increased pay. Okay. Once that is done and you get a full understanding of this world of insurance and billing, we're going to continue our learning to commit to ongoing education about insurance policies and healthcare changes. Build your network with mentor and peers who can support your professional growth and achieve excellence by developing your representation as reliable, knowledgeable authorization specialist. And you're also going to purchase the link in the, you're also going to click on the link in the description below and purchase the $10 PDF that gives you additional resources that will help you out in your role. This PDF has a multitude of step-by-step guides of what you will need to get started. Um, Basically everything that we just went over, but a little bit more detail and something tangible to help keep you motivated. And just if you don't want to keep watching the video over and over again, you can just have this as a guide to look at. um, so yes, so your role as a healthcare authorization specialist directly impacts patient care by ensuring access to needed health medical services. While the work can sometimes feel administrative, remember that behind every authorization request is a patient waiting for care. Okay? Your diligence and may expertise make a significant difference in the healthcare delivery. With dedication and continued growth, you can build a rewarding, stable career in this essential healthcare function. The skills you develop will serve you well through your professional journey, whether you're whether you remain in authorization or expand to other healthcare administration roles. All right. So like I said, let me do my outro before I. All right. So thank you for joining me in today's spotlight of medical authorization specialist. Now, what did we learn in this video? The reason why you need to like, share, and subscribe. We learned about what an authorization specialist was and why it is so important. We learned of the daily responsibilities and workflow. We also learned the pros and cons of this job. We learned the education, the certification, and key skills we would need to do this position, the expected salary and advancement paths. We also received tips for success and common mistakes to avoid. And lastly, we went over some medical terminology that you will definitely need to be a professional in this role. Now, if you are ready to get started, like I stated before, you can click on the link in the description below. And that is going to be your tangible blueprint that you will have to go ahead and get started on your journey. Now, thank you again for joining me on medical careers that you did not know about. I really enjoy doing these videos because I enjoy being in the medical field. I started from the bottom up in this field, and as I share this information with you, it really helps motivate me to keep going because I'm currently taking this class and I got an exam coming up soon. So I'll tell you all more about that in later videos. But once again, be sure to like, subscribe, click the link in the description below if you are interested in getting started in your medical authorization specialist career, or you could just rewatch the video and get the resources from there. You all have a good evening, and I'll see y'all next time. Bye.